Fenofibrate is a medication that, when used with a proper diet, can help lower bad cholesterol and fats in the blood, such as LDL and triglycerides, while also raising good cholesterol, HDL. It does this by increasing the natural substance in the body that breaks down fats in the blood. This medication belongs to a group of drugs known as fibrates. Lowering triglycerides in people with very high levels may decrease the risk of pancreas disease, pancreatitis. However, it might not lower your risk of a heart attack or stroke. It's important to talk to your doctor about the risks and benefits of taking fenofibrate. In addition to eating a proper diet, other lifestyle changes that may help this medication work better include exercising, losing weight if overweight, and stopping smoking. Be sure to consult your doctor for more details. To take fenofibrate, simply follow your doctor's instructions and take it once daily. It comes in different forms, so it's important to stick with the type prescribed by your doctor. Some forms should be taken with food, while others can be taken with or without food. Ask your pharmacist for more information. The dosage will depend on your medical condition and how you respond to the treatment. If you're also taking other cholesterol-lowering drugs, take fenofibrate at least 1 hour before or 4 to 6 hours after those medications to ensure proper absorption. Taking fenofibrate regularly at the same time each day will give you the most benefit. Don't increase your dose or use it more often than prescribed. Even if you feel well, keep taking it as directed. Remember to follow your doctor's advice about diet and exercise, as it may take up to 2 months to see the full benefits of this medication. It's important to remember that your doctor has prescribed fenofibrate because they believe the benefits outweigh the potential risks of side effects. While many people do not experience serious side effects, it's important to be aware of potential issues. Rarely, fenofibrate may cause gallstones and liver problems. If you experience nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine, it's important to contact your doctor immediately. Additionally, muscle problems can occur, which may lead to a serious condition called rhabdomyolysis. If you notice muscle pain or weakness, especially with fever or unusual tiredness, it's important to seek medical attention. In some cases, fenofibrate can cause a severe lowering of good cholesterol levels. It's important to have your HDL cholesterol levels checked regularly and keep all of your lab appointments. Serious side effects such as easy bleeding/bruising or unusual tiredness should also be reported to your doctor. In addition, seek immediate medical help if you experience chest pain, sudden pain/swelling in the leg, or signs of infection. While rare, a serious allergic reaction to fenofibrate can occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of potential side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking fenofibrate, it's important to talk to your doctor or pharmacist if you have any allergies, especially to other fibrates or inactive ingredients like soy. If you have a history of kidney, gallbladder, or liver disease, it's important to let your doctor or pharmacist know before using this medication. Also, make sure to inform your doctor or dentist about all the products you use before having surgery. If you are pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so it's not recommended to breastfeed while using this drug and for 5 days after stopping it. Make sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with fenofibrate tablet is blood thinners such as warfarin. Additionally, it's important to note that fenofibrate is very similar to fenofibric acid, so it's important not to use medications containing fenofibric acid while using fenofibrate. When using Fenofibrate tablet, it's important to follow the dosage instructions provided by your doctor. Make sure to take it regularly to get the most benefit from it. It is typically taken once daily, with or without food. Be sure to take it at the same time each day to help you remember. If you have any questions about the best time to take this medication, consult your doctor or pharmacist for more information. If you or someone you know has taken too much Fenofibrate tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 for emergency assistance, or contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure proper medical attention. It is important to not share this medication with others. You should have lab and/or medical tests, such as cholesterol/triglyceride levels, kidney/liver function, and complete blood count, while taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Fenofibrate tablet, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take the next one at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Fenofibrate tablet, it's important to keep it at room temperature and away from light and moisture. Different brands may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist. It's also important to keep this medication out of reach of children and pets. When it comes to getting rid of expired or unused medication, it's important to do so properly. Instead of flushing it down the toilet or pouring it into a drain, it's best to consult with your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.